Good evening. I'd like to make a presentation on major depressive disorders. The reason why I chose this disorder is 17.5 million Americans have this disorder, and also 11.5 Americans among them have suicidal ideation. That is why I chose this disorder. But there are symptoms that you have if you have major depressive disorder. Depressed mood, diminished loss of interest or pleasure in almost all activities, significant weight or appetite disturbance, sleep disturbance, psychomotor agitation or retardation, loss of energy or fatigue, feelings of worthlessness, diminished ability to think, concentrate, and make decisions, recurrent thoughts of death, dying, or suicide, long-standing interpersonal rejection ideation. These are the symptoms according to DSM-5. But what is causing major depressive disorder? Some have this disorder because of genes. Some have this disorder because of environmental and psychological situations. For example, physical abuse, emotional abuse, sexual abuse, exposure to violence, exposure to accidents. These are the reasons why you may have a major depressive disorder. But when you have major depressive disorder, according to DSM-5, we have the time criteria. It has to be at least 2 weeks long, cause significant distress or severely impact social, occupational, or other important life areas. It is not precipitated by drug use, not meet the criteria for another mental disorder like schizophrenia or bipolar disorder. It is not going to be better explained by bereavement, such as the loss experienced after a death. Loss or separation of parents can also cause a major depressive disorder. But how are we going to have it treated? I like to propose 2 methods in treating major depressive disorder. Number 1 is psychodynamic therapy. It is a kind of talk therapy many people imagine when they think of psychological treatment for depression. That's because the image of the clinician and patient probing the past is a staple of our popular culture. It can be found on sitcoms or in jokes, and psychodynamic therapy has been a major element in movies like Good Will Hunting and Ordinary People, and on the stage in plays like Eggers. Psychodynamic therapy is designed to help patients explore the full range of their emotions, including feelings they may not be aware of, by making the unconscious elements of their life a part of their present experience. Psychodynamic therapy helps people understand how their behavior and mood are affected by unresolved issues and unconscious feelings. In other words, it is digging into the past of a patient, childhood trauma, childhood experiences, childhood neglect by the parents. Okay, but what distinguishes psychodynamic therapy from other therapies for depression? Psychodynamic therapy is one of 3 main types of therapy used to treat depression. The other 2 are cognitive behavioral therapy, CBT, and interpersonal therapy, which is IPT. What distinguishes them is the nature of their focus. Both CBT and IPT are focused on understanding and modifying certain processes or behaviors. Actually, it is modifying thoughts. So that according to CBT, thoughts, feelings, behaviors. If you have inaccurate thoughts, illogical thoughts, you have negative feelings, bad feelings. And those negative bad feelings will cause inaccurate bad behaviors. So that's the point. So CBT, okay. So CBT focuses on identifying and changing dysfunctional patterns of thought. But with IPT, the emphasis is on identifying issues and problems in interpersonal relationships and learning ways to address and improve them. But both CBT and IPT are also time-limited, short-term therapies. The emphasis is on learning new patterns rather than analyzing why the dysfunctional patterns are there. But psychodynamic therapy, on the other hand, grew out of the theories and practices of Freudian psychoanalysis. Psychoanalysis is based on the idea that a person's behavior is affected by the unconscious mind and by past experiences. Psychoanalysis involves an intense, open-ended exploration of the patient's feelings and emotions, often with multiple sessions in a week. The sessions include an examination of the feelings the patient is aware of and those the patient is unaware of before therapy begins. Psychodynamic therapy is less intense than formal psychoanalysis. Sessions usually occur once a week and are typically 50 minutes each. Patients usually sit up in a chair rather than lie on a couch with a therapist out of sight. But unlike IPT and CBT, both of which have sessions that adhere to a formal outline structure and that set specific learning agendas, psychodynamic therapy sessions are open-minded and based on the process of free association. In psychodynamic theory, the patient is encouraged to talk freely about whatever happens to be on their mind. As the patient does this, patterns of behavior and feelings that stem from past experience and unrecognized feelings become apparent. The focus is then put on those patterns so the patient can become more aware of how past experience and the unconscious mind are affecting their present life. Whatever happened in the past or in their childhood is affecting their present life. Another distinction between the types of therapies is that psychodynamic therapy is not necessarily a short-term, time-limited treatment. With some courses of therapy may end after 16 or 20 weeks, other instances may go on for more than a year. But the question is psychodynamic therapy an effective treatment for depression? The answer is yes. Part of the reason is that practitioners of psychodynamic therapy were not as focused on doing empirical research as practitioners of other therapies such as CBT and IPT. But over the past couple of decades, that has changed and more studies have appeared. So, what are the main features of psychodynamic therapy? Psychodynamic therapy involves an exploration of the entire range of a patient's emotions, feelings, and thoughts. With the help of the therapist, the patient finds ways to talk about feelings that include contradictory feelings, feelings that are troubling or threatening, and feelings that the patient may not have recognized or acknowledged in the past. The exploration takes place in a context that recognizes the fact that being able to explain the reason for an emotional difficulty does not mean the person is capable of doing anything about it. The goal is to foster the internal resources needed to deal with and effectively manage those difficulties. And these are the evidence-based treatment interventions for this disorder. Researching this disorder has enhanced my own personal and professional understanding of diagnosis and treatment. And I think there is further research concerning major depressive disorder and I'm happy that I made this presentation.